Welcome to The Better Life with Dr. Marianne Pinkston. Join Dr. Pinkston today as she teaches you how an integrative approach to health, combining holistic and contemporary medical information, can lead you to the better life. And now, here's your host, Dr. Marianne Pinkston.
Hello out there, everybody. I am Dr. Marianne Pinkston, and you are watching or listening to The Better Life with Dr. Marianne Pinkston. And I have always some great guests. Lately, I've been having some wonderful guests, and I am so excited to have this lady on in particular because I think we're soul sisters in some fashion. I met her through A4M, which is the American Academy of Anti-Aging and Regenerative Medicine. But she is not isolated just to A4M. She is all over. She is on Instagram and all over social media and has some wonderful products, has written some fantastic books. She is a gynecologist, triple board certified gynecology, internal medicine, and integrative medicine. And I am so happy to have you on, Dr. Cabeca. Good morning. How are you?
Good morning. Good morning. It's great to be here with you. I'm doing great.
I'm excited to have you on finally. We've been chasing each other a little bit, but I think we finally get to sit down and visit with each other. So I want to dive right in because you've got so much information. And I think you are, we are targeting a lot of women, but I want guys to listen too, because I think through your book, MenuPause, I love this title, MenuPause, I think you have some fantastic information for not just women and balancing their hormones, helping with weight loss, but I think, the guys could probably join in and enjoy some of these dietary recipes and things like that. But tell me a little bit about you and your activities and what you are up to these days.
Yeah, I will. And with MenuPause and also creating recipes for women in menopause, it's always like, okay, if it works for women in menopause, it works for pretty much everyone.
Absolutely.
And we've had a lot of couples go through my programs and my meal plans and just it's true. The guys stick to it. They do better. They lose more faster. And,
right, of course.
They can definitely, I know, it's so frustrating for
Always
us women that are listening here. It's like, just be prepared. But
yes.
Anyway, it's all good because, that's growing healthy together is what it's about.
Absolutely.
And it really blows me away because this is my third, thank you, and I will say thank you, God, best-selling book.
Yes.
And so it is, and it's been amazing. We're getting international distribution around the corner here. And so
Wonderful.
I'm excited about that too, as to see my books translated. But it really does blow me away because between all my own struggles, my journey
yes.
in through hormone hell, let's say, and being well over 240 pounds at one point, having hair loss, mood swings, irritability, and the worst part was depression in my life with diagnosis of an early menopause and depression and infertility. I mean, it just is devastating. And my doctor's bag was empty. And I trained at one of the best institutions in the world in women's health and OBGYN at Emory University. And my doctor's bag was empty.
Right.
And so going from there to where I am now, really creating practical solutions, filling my doctor's bag with the tips and techniques and, natural strategies that we didn't learn in med school.
That's
plus what we do know with bioidentical hormones and what I've been teaching for the last decade. But filling my bag with these things to really empower individuals to be the CEO of their health, to be empowered in their body. And I think, it's more important even for women to own that position.
Yes.
To own that empowerment position, to not give it away to a prescription pad, to not give it away to a surgical knife, to not give it away to an insurance company, to not give their power away.
Right.
And take it and internalize it and own the power we have over our own body. So
Absolutely.
it's been a journey for me.
Well, it has been. That's why I feel like we're soul sisters. You had a significant amount of, weight loss and, to become ill and to not be able to go to your physician, and even I as a physician, I wasn't able to find my own answers either in the contemporary side of medicine, which is very good. It has all of its pros and cons as well as the other side. But to be able to learn, as you and I have learned through integrative medicine, about taking care of our bodies, and like you say, I love what you said, being the CEO of your body and taking charge of your health is absolutely amazing. You have done that marvelously, and you've written not just this book, but several books. And I know that you have, spoken all over, and to be internationally, renowned author now. How wonderful! Congratulations. So, what is your charge now? What is, first and foremost on your plate now for women's health? How can we help women get through these depression and weight gain, and just the way that we feel so terribly? Not only just menopause, but leading up to menopause, many years before menopause, before you actually go through it, we feel so badly.
Yeah, no, and I think the first thing is really realizing food is medicine, right? We do know that food is medicine.
Yes.
And not just the food we eat, but what the food we ate was sprayed with,
Right.
was injected with, all of those things. The quality
True.
of what we're putting in our mouth is critical. And
Yes.
then also when we're eating, right? There's that part of the food we eat, but when we're eating it. And, even the concept of who we're eating with. If we are stressed when we're eating a meal, we're going to increase more cortisol and increase more insulin, becoming more insulin resistant, and have digestive issues digesting that meal.
Right.
The same meal, if we eat it with fun and we say grace before it, and we are enjoying ourselves, calm, and in a relaxed physiology, we're going to digest that meal a lot better and absorb the nutrient value a lot better. So it's not just calories in, calories out, right? That's the thing. That's the really important thing that we were brainwashed with, I don't know, in the 80s,
Right.
up on through to today.
Right.
But
Yes.
there's, it is about food as medicine. That's the first thing, really, Marianne. I think that's what I love so much about what you're doing too, and sharing all your information, is because of your story, and being able to share your story, and being able to decipher what's works and what doesn't work. And so
Right.
food as medicine is number one. And then the second thing is our sexual health is important for longevity.
Absolutely.
It's important for our relational health. And making that a priority in your life, in your marriage, is rejuvenating, is the best medicine
It is.
that you can give yourself. It really is. And that contributes to the all empowering hormone, oxytocin.
Yes.
Oxytocin, the hormone of bonding, but it's also the most longevity provoking hormone.
Right.
So that's those two things are really key. And then the third is sleep. And those three areas, and we can focus on that: food as medicine, healthy sexual function, sex life, intimacy with the person we love in our life the most, and sleep. We are going a long way to healing.
Absolutely. Three huge topics that we could break down and make several shows out of. I
for
tell
sure.
you, there's so much information in what you just said. And so I want to concentrate a little bit on sexual health for a moment, because I don't know your experience, I'm sure it's very similar, but how many women beginning in their 30s, sometimes late 20s, come in, and definitely 40s and 50s, come in and just say, I just have no sex drive whatsoever. And some women are to the point now where they're like, I don't even care. It's fine if I don't. And I try to relate to women that, first of all, that is not a normal way to feel. It may be a part of normal aging as we, go through our late 20s. I think evolution just basically set it up that, we have babies in our 20s, and at 30, that's it. You're done. Goodbye. Because we start losing all of our hormone, drive, and our testosterone in our late 20s, early 30s. But, I tell women, I said, this is important to your relationship, but not just to your relationship and to your man, or to your significant other. It is important to you. It's important to wake up and feel pretty, and to feel attractive, and to feel full of life. And that is part of your sexuality too. It's not just about intercourse and with your partner. It is about feeling, involved in your life and active and healthy, and sexuality is a part of your self-esteem. So do you find the same, issues with women, starting in their 30s, that they're losing their, sexuality? And I think it just, you lose your oomph for life a little bit, your mojo.
Yeah, yeah. And I think this is one thing that I really work in my online groups and in my girlfriend doctor community, is that healthy is sexy.
Yes.
Right? And when you're healthy, there's a great Arab proverb that says, when you have your health, you have 1,000 wishes. When you don't have your health, you have but one.
Right.
Right? And to remember that. But healthy is sexy. And I say this in my community. I want you to get the compliment like, wow, you look so healthy.
Right.
Right?
Right.
You look so healthy. I mean, you're radiant, you're glowing. And that is attractive.
Yes.
And that's attractiveness. And when you are healthy, when you have that energy, you have that magnetism.
Yes.
And so, but it comes from many ways. And we start to lose it certainly when when we have hormone disruptors in our body, when we've been on years of birth control pills, when we've been taking acid medications, when the food we eat is polluted, and oh my gosh, I can go down a tirade on this because I'm really passionate about it, because we're, the water we drink has endocrine disruptors in them, for heaven's sake. So if, and we're seeing generations of this. I'm a mom of 5. I have 4 daughters. And I am always trying to address these issues to the best of my ability with them, as well as in my home, what I can control. So endocrine disruptors are really prevalent. And so we're seeing in medicine women younger and younger coming in with these hormone disrupted symptoms.
Yes.
And I always say within 2 weeks, definitely by the time you have your next cycle, we can just really restore your hormonal balance as we start dumping out the toxins safely. That's supporting phase 1 and phase 2 detoxification, supporting gut health, really working with digestion and elimination, so that is working as it should. What comes in must go out healthfully, right? The right way.
Right.
And so as we're working, and that's important for hormone balance. I mean, I can't fix someone's hormones without fixing their gut completely.
Absolutely.
So it is, that piece of the information. And as I've seen, especially with sexual health, is as a gynecologist and obstetrician, the only female one in my small town that I had my solo practice in for a long time was just having this conversation. Dr. Anna, they would come in, Dr. Anna, I know I love my husband, but I just don't want to have sex with him. I mean, I never initiate sex. It's, it's an issue. And then I'd say, well, what happens once you get started? And they said, well, once we get started, I'm good to go. Then I'm turned on.
Right.
I'm like, well, that's secondary sexual desire, and that's completely normal. But let's look at why you're not initiating. And so that's where I actually developed a whole course called Sexual CPR. And there's a free, intro to it on arousal, and the top 2 secrets I want men and women to know about each other. And one of the big things is that for women, that secondary desire is normal, but to initiate more initiation of sex, we need to feed our primary desire. And we do that through establishing intimacy post-sex. So when oxytocin's high, and I'll give you an example, Mary. May I?
Absolutely.
Okay, so I had a couple that came into my practice. I always like to see when I'm dealing with sexual health and sexual health issues or hormone balancing, and anytime, where, again, physiology affects behavior, hormones affect our physiology. If I'm going to do something, both partners have to be on board with it. So that's a really big thing. So I had this couple come in, and a gorgeous couple, and they were in their mid to late 30s. They'd been married 7 years or so. And they were both very, very physically healthy. And he goes, Dr. Anna, my wife enjoys intercourse. She has great climaxes. I can always tell, that she's enjoyed herself. And she's like, yes, authentically, yes, I have great climaxes. She goes, but she never initiates sex. And she goes, I don't have that desire.
Right.
And
Very
I said,
common.
well, I asked him, I said, well, what do you do after you guys have sex? He goes, what? I said, well, what do you do after you have sex? After she climaxes, after you do, what do you do? And he said, well, I roll over and go to sleep. I said, like 99% of most men. But what women need when oxytocin is high, that intimacy connection. I said, so take 2 minutes. I mean, 2 minutes, as long as it takes to brush your teeth or whatever it may be. But after you have sex, just speaking to each other, just have a conversation, where you can breed intimacy, what you love about each other, what was fun during your playtime together, focus on the positives and really nourish that connection, that value, how you value her in your life beyond the physical.
Right.
And with that. And so I said, practice that. And, that's your homework. Come back in a few weeks. And so they didn't even come back in. They called me. They're Dr. Anna,
We're
my
fixed.
gosh, she's initiating sex over half the time now. And she just said, I'd seen her for a follow-up GYN several months later.
Right.
And she said it just really made the difference. And she didn't realize what she was missing in that connection, because sex is intimacy, right?
Right.
But she was missing the psychological intimacy, the connection piece from that. And then with that, she's like, oh, I want more of that. And then that feeds the subconscious desire for that connection, that bonding. Wonderful. And that's the beauty of oxytocin and just a good example of how it works differently in men and women.
And oxytocin is something that can be prescribed, right? I often do in my practice. I know you have a great way of doing it that I have looked at and wanted to do. How do you use oxytocin in your practice?
Yeah. So I have prescribed oxytocin, and I initially started prescribing it, but I'll tell you, first of all, we prescribe it in pulses. We don't use it long-term daily, because we never want to suppress our own production of it. So there's a very strategic way to prescribe it. And I'll give you a couple of ways that I use it. But the first is certainly in sexual health to help with orgasm. You can do vaginal oxytocin. Sure. And that's a good way. Sublingual and troches is another way. And you can do it 30 minutes prior to intercourse or, so that can help. But I recognize too that it's variable results in many people. But when I experienced my own PTSD, my own trauma, devastating grief, post-traumatic stress disorder, and full blown, I always say we go from PTSD, post-traumatic stress disorder, to post-traumatic resilience and growth. And that's what I really want to empower people with. And oxytocin is certainly a tool, again, naturally first as much as possible, but if we need to prescribe it. And as I started seeing that disconnect between with post-traumatic stress or chronic everyday stress, where cortisol goes up and oxytocin goes down, and then and I write this about in my first book, which I recommend anyone with trauma, grief, everyday stress to read, certainly chapter 8 in my book on stress, The Hormone Fix. The book is called The Hormone Fix, and it is my magnus opus. So I highly recommend it. Men, women, please read that book.
And that will be on the website. I will have that for people to reference on the website.
Thank you.
Yes.
Thank you. And I go deep into my story and my trauma, but also the solution. And that's really key, because I want people to understand that when you're under stress for a long time and cortisol's been up, the paraventricular nucleus in the brain will say, okay, cortisol, you're frying me out. I'm suppressing you, essentially. Exactly. Yes. So it's not your adrenals give out or they become, weak. No, it's that we are suppressing cortisol function.
Yes.
And so, but at the same time, oxytocin remains suppressed. So you're in this dangerous physiologic state of low oxytocin and low cortisol. And that feels like, I love my husband. I don't feel love for him.
Right.
That feels like I used to love going into my work and my medical practice, but I don't, I can't even bear it anymore. The paperwork's overwhelming. I feel overwhelmed and stressed. That feels like burnout. Yes. That's disconnect. It's the physiology of divorce.
Yes.
It's the physiology of depression.
Yes.
It's anhedonia. You have no pleasure. And it is really understanding to realize this, because just as external factor influence this, we can use external factors to improve this and to get our body back in balance so that we have that beautiful fluctuation in cortisol and oxytocin. So So when I realized that disconnect, because after burnout, after PTSD and our trauma that we experienced as a family, I went through divorce, I burned out of my medical practice. And it was that aha moment. Oh my gosh, I'm like, what is happening here? Because this was not the path I'd laid for myself, nor did I understanding the high rates of divorce after trauma.
Yeah.
We worked to not have this happen. So what happened? Why was I so disconnected? And that's where I dug into the research, the basic science research, looking at stress, cortisol, trauma in children and adults and war victims and women through perimenopause. I mean, there's a paucity of it, but there's enough. There's enough to really look at this. And then when we tie in oxytocin, when I tied in oxytocin to it, I mean, it made I was able to understand. And as a physician, then I could see when my patient came in and was experiencing these things, what happened? Was there a traumatic injury? Was there, is there PTSD? Was there everyday stress? Like my burnout physicians, I'm like, okay, like while we're doing these other things, okay, you can't listen to the news on the way. When you leave your office, you cannot listen to the news. You have to listen to music that lights you up.
That's right.
That makes you want to dance. You have to talk to your best friend that makes you laugh. And if we need to, we're going to give you a sublingual oxytocin on your way home. So when you get in through the door to your husband, to your kids, that you are in your body, not at the office still, not stressed thinking about everything else, but you are in your body with a peace and a calm that we can help you with until your body catches up, until we reverse that high cortisol through everything that we know to do. That's been the journey.
That is amazing information. And you don't know how, you do. I know you do, but I don't think people understand how many people live at that level. I'm so sorry about your traumas and all. I know that we all have that to some aspect, and what you brought up is just very, very important. We're going to take a short break and come back on the other side. I want to investigate that just a little bit more. And you've got a great product I want to mention too, but we will be back in just a few minutes.
Fatty liver is linked to two different situations, alcohol and diabetes or obesity. In both cases, patients can have no symptoms. In the United States, and in particular, Texas, the most common cause of liver disease in general is non-alcoholic fatty liver. Again, associated with overweight, obesity, and/or diabetes. Additional risk factors include high cholesterol, high blood pressure, Hispanic ethnicity, and postmenopausal status. At Pinnacle Clinical Research, we offer a quick, non-invasive ultrasound-based screening assessment called FibroScan. This test is done at no cost to you, and we do not take insurance. The test will measure the fat and stiffness in your liver and stage your risk and development of fatty liver disease. You will meet with a provider immediately following your scan to go over your results. If you're interested in getting more information on your liver health, please call 210-982-0320 and schedule your FibroScan today. We are conveniently located in the Medical Center at 5109 Medical Drive.
Welcome back, and thank you guys for joining us. I am Dr. Marianne Pinkston, and just really quick, I want everybody to know that you can find, not only is this in radio in San Antonio, but you can also find me and this show on all the platforms of podcasts. So go to drpbetterlife.com, and you can find all the podcast and YouTube links and whatnot. And you can find out more about Dr. Anna Cabeca, who's with me today. And she has a wonderful product, I know, that ties in to what we were talking about before, women and sexual health. I think that vaginal dryness is a very difficult thing for women to identify, first of all, but talk about what have you done to relieve women of this issue?
Yeah, well, one thing is I realized that one of the reasons sometimes we don't want to have sex is because we have discomfort, especially as we're getting older. Yes. And vaginal dryness, whether it's during intercourse or discharge, odor, urinary infection after intercourse. And it's because the vaginal tissue will change, will thin out, just like we'll get laugh lines here, right?
Right.
We will have dryness down there. And so we want to address that. And so working with hormones, bioidentical hormones, I recognized that we needed something that was clean without endocrine disruptors,
right,
and a woman could use topically, and and that would restore the health of the tissue, the clitoris to the anus, I always say, and everything in between. So for vaginal health and vaginal dryness, and I created a product called Julva. So to remember, like, vulva with a J. So Julva, joyful vulva, Julva. And that has DHEA, plant stem cells of the alpine rose, emu oil, coconut oil. It's really designed to penetrate deeply into the tissue to help restore that natural moisture. And we have a 65-year-old patient who said, Dr. Anna, my GYN says I have the vagina of a 25-year-old.
Everybody, so, on top of everybody's list.
That is a marker of longevity. Let me just tell you that.
Yes.
So, yeah.
Now we just need a whole body cream for that now, and I think that would be ideal. Well, that is great. And so I am going to have that on the site as well so that people can look for a link and get that. So you have so many ideas and so much so much information. I think I wish we could get it all in, but I'm definitely going to be asking you to come back on because you've got so many different topics from weight loss to sexual health and, just women's health that I think are so important. I am so thankful that you joined me on the show today. Thank you. And so this is her book, the MenuPause. I'm going to have a link to that on the site as well. And you can go to drpbetterlife.com and you can see all about Dr. Anna, the girlfriend doctor. That is brilliant. Since I've met you and I heard that, I have been digging and trying to find some wonderful name. Like, that's so catchy. It's perfect.
Oprah's executive producer named me that. So
really?
It's stuck.
Oh, God. Well, that's all I have to do then is call Oprah's executive producer. Maybe she can.
She's amazing. Sherry Salata. Yeah.
Oh, that's
She's
hilarious.
Amazing.
So you've met Oprah. You have really
No, I've not met her in
Not?
person. No. Not yet, but it's on my bucket list. It's on my bucket list. Mm-hmm.
Exactly. Oh, that's wonderful. But you have accomplished so much and been all over, and I applaud you for what you are doing for women's health. I follow you, and therefore we are going to have all of your information, again, from social media to your website to your products to your books. I'm going to have all that on drpbetterlife.com. Is there any information that you would like for listeners to have as well, to go direct to?
Well, I think, my website is dranna.com, and I'm at The Girlfriend Doctor on Instagram and social media, Facebook. So definitely connect with me there. I'd love to see you all.
And she does. She's very active on her social media, which is wonderful. But Dr. Anna, thank you. I appreciate you coming on. We will have, again, all that on drpbetterlife.com. I hope everybody has a wonderful week, and we will have her on again. And thank you, Dr. Anna.